So another thing we're going to demonstrate is how to get out of a bed after having a surgery on your back, like a Brazilian butt lift or posterior body lift, in which the surgeon has instructed you to lay flat on your stomach after surgery for 1 week. So with this, even with BBL, that is a little bit longer of how long you're going to be laying here, but just for general purposes, I want to instruct how to get out of this position, because as you can imagine, it can be quite difficult to maneuver. So it is helpful to have a caregiver present to assist you with this until you feel more comfortable doing it yourself. It is really important after surgery to get up and move around, not only to reduce the risk of blood clots after surgery, but that way you're able to go up to the bathroom, get a drink of water. As you can imagine, you're going to be dehydrated and you're going to be sore, so having the assistance is really important. All right, so in this position, Megan has had a Brazilian butt lift, so her buttocks is off of the bed and not compressed. If she was sitting, she would be using that BBL pillow provided to you at your pre-op appointment. A suggestion for how to get up is going to be demonstrated. So Megan, I'm going to have you go ahead and bend this leg and pivot. And then go ahead. She has not had surgery on her front, so she can use her front muscles to turn on her side. It is important, if you've had any surgery, to just offload from the muscles that were operated on to reduce strain and tenderness. So for example, if you did have a back surgery with the chest involved, this would be altered to make sure that she's not using those muscles. In this case, she hasn't. So we're going to go ahead and turn to the side like this. And then I'm going to help her get into a seated position. It is important to do this in a stepwise process because you can feel lightheaded after surgery, and I want to make sure that you don't get dizzy and fall. All right, Megan, so I'm going to have you go ahead and scooch to the front until your feet are firmly planted on the ground. We did say that with the BBL, you cannot sit on your buttocks without that BBL pillow. It is okay in temporary cases like this to sit down so you can get to a standing position. All right, are you ready to stand? You don't feel lightheaded? Okay. So from here, we will stand. It is okay for her to stand upright and make sure that she's looking forward, not directly at the ground, because this can help to reduce dizziness as well. And we'll move to where we need to go. Let's come on back. All right. We will start by sitting again to get back into bed. From here, we will undo what we did to get up. So you'll go ahead and lay on the side, and I will help you in any way that she needs. It's important to have constant communication to make sure you know if you're doing anything to worsen pain or that you're actually helping. Do you need anything from me with that? Are you okay? All right, so then she can move back to where she needs until she's laying down again. So now we're going to demonstrate how to get out of a recliner if you've had a Brazilian butt lift or a BBL. When you have this procedure, it is important to always offload off of the buttocks to make sure to always have blood flow to that area for the first 3 weeks after surgery. We do give you a BBL pillow to use while you're at home and sitting on a chair, so that way you can always do that. Megan here is demonstrating. She is using the BBL pillow, which I'll show you when she sits up. It's important as a caregiver to be able to help with getting up out of a recliner to make sure that she doesn't fall, because she could be lightheaded after surgery and she's definitely going to be sore. So with the BBL, what we're going to do is, just like in all of the other instances, do this slow and in a stepwise process for her safety to make sure that she's not going to fall. We're going to scooch to the edge as best you can. She is using her arms in this case because she has not had a surgery on her chest. Okay, you ready? Yeah. Perfect. So in this case, again, her feet are planted firmly on the floor. We're going to stay here for a moment to make sure that she doesn't feel lightheaded, because after surgery with dehydration or with pain medications, it is common to feel lightheaded when you're getting from a reclined position to a standing position. We want to make sure that she's safe. Do you feel ready to stand? Yeah. Perfect. So with my support, I'm going to be helping her from this point. She's going to stand, She is able to stand straight up because she hasn't had a tummy tuck, and then we can go ahead and move around as we need. It is important after surgery to always get up and move around frequently because we do want to reduce the risk of blood clots after surgery, and it does allow her to get up, go to the bathroom, and get a drink of water as well. So I'm going to have you briefly move over just to demonstrate. This is the type of pillow that we are using when we are on a recliner or a chair of any kind, if you're back to work or any other way. So to sit back down on this, since we did demonstrate how to move around in the previous clip, we'll go ahead and sit back down. Make sure that she backs up all the way so she knows where the chair is behind her, and then she is going to sit back. Now, at this point, the pillow is directly under her buttocks. It's okay if it's for a couple of minutes or a second while she's getting adjusted, just as long as her final resting position, it is under her thighs and not on her buttocks. So we're gonna go ahead and do what we need to kind of move around until she is comfortable. And then we'll recline back, and that is it.